Day 27 today, and so far all is going well. As you can see, again, the hair's all off. It's starting to come back a little bit, but that's the strands of hair that basically hadn't completely fallen out. So all is looking well. I'm off the TPN, off the morphine, off the cyclosporin now as well, IV. That's given in tablet form as of today. I'm off ruxolitinib now as of yesterday. So drugs are coming down slowly. And good news is counts are coming up. And now they should come up very, very rapidly. I got a sheet here that outlines my counts for the last couple of days. Today is day +20. What's the date today? The 24th. So we are 24, 25, 26, 27, +27, or 26, 27, you can say. Days since transplant, and engraft is going well so far. They expect engraft to take about anything up to about 50 days to complete. But looking at the blood results, they're going well, especially Roxy, being off Roxy now, because Roxy, what that does is that sort of suppresses growth, like suppresses your counts, such as your neutrophils, your white blood count, even hemoglobin and platelets. So basically it suppresses your blood counts, suppresses your marrow slightly. But I'm off that completely, so now there should be no suppression at all, and so the marrow can do what it's supposed to do, fully fledged. So that's it. So far, as I said, so far so good. Little bit tired, as opposed to when I was on a TPN stuff. I'm eating well, no issues there. Sleep's a bit all over the place at the minute still, because that cyclosporin, it sort of makes you a little bit tired, hot. And secondly, magnesium, when you have magnesium infusions, they make you very sleepy, very dozy. But that's because cyclosporin knocks your magnesium levels down, so you need sort of regular top-ups. But from tomorrow, or should I say today, I won't have any IV infusions. I'll be having that in tablet form. And then if needed, from time to time, they may give IV infusions. Have a look at the counts, you'll see how they're going. So this was on the, it's not very clear, is it? So 22nd, total white blood count was 1.6. Hemoglobin was 87, platelets were 55, and neutrophils were 0.5. Sorry, neutrophils were 0.3. Neutrophil count was 0.3. Then today, or yesterday should I say, white blood count has jumped up to 2.1 from 1.6. Hemoglobin is 97 from 87. Platelets are 72 from 55. And neutrophils are 0.5. They're saying that once neutrophils get to about 1, that's when they're probably looking to send me home, and obviously come in as an outpatient. Sorry, to begin with, probably twice a week, and then obviously see how things are going. So initially about twice a week coming in, and obviously if you need any transfusions, like magnesium, they'll give them to me. But the way the counts are going at the minute, I forgot to mention one. My CRP always used to be very high, because but CRP, if you look at the total, where are we? C-reactive protein level, which is there. Yesterday it was 7.7, today is 6.3. Normal range is anything up to 5. So, this is excellent for me, because that number's always been in the 40s, 50s, 80s, hundreds. In fact, at 150, which is, that means there's a seriously something going on inside, so like sepsis. And I've been battling with that for a few years now. So that shows that things are working. My mouth, you can see, a lot better. Gums are perfect, a lot better. No more sort of ulcers in the mouth. I can eat properly. Swallowing is no issue. There's no pain or anything swallowing. So the immune system's kicking in. So as long as there's no graft versus host disease, which fingers crossed there won't be, because my brother was 100% match, I think we're doing good. Very good. So I keep in touch with, obviously, doctors come to see me every day, and I like to get their feel on things, because they do these transplants. It's like a conveyor belt, 15 rooms. One patient leaves, the next patient's ready to come in straight same day. So you don't have a room empty here, which is good. But yeah, so they're saying it's going according to plan. They're happy with everything. But obviously, up to about 100 days, they've got to monitor things very closely, especially the liver, your gut, and all, make sure that there's no graft versus host. Or if there is, the consultant, when I started, before I started the treatment, he goes, graft versus host between 0 and 4 is a grading, 4 being extreme, like literally life threatening, like if you got 4, you're in trouble, and 0 being none. He goes, we want all patients, in an ideal world, if you ask me, we want them to have 1, which basically means that they get the effect of graft versus leukemia. So what that does is basically new bone marrow also hunts down any leukemia cells that are left over, if there's anything left over, and it eradicates them as well. But with that, you potentially have some like skin issues and stuff like that, in a sort of worst case scenario. But he goes, we prefer that as opposed to 0. So let's see. But so far, as I said, I can't complain. I feel good. Dietitian came down. They keep monitoring on your food intake. They're saying you need to intake a lot of food, because obviously there's a lot of growth going on inside your body. My weight has been stable. It's about 105 kilos, 106 kilos at the minute. And I was talking to her about reducing my weight somehow back to about 90. She goes, not yet. We want you to be at this sort of weight, and we want you to maintain this weight, for the very reason that basically your body needs a lot of energy at this minute, whilst everything that's going on inside. And you keep up the carbs, keep up the protein, keep up the fats even. She goes, and that, like say for example, normal breakfast I have, they always give me add-ons like high protein porridge or high protein snacks, like a jelly in the afternoon, or fruit cocktail, or yogurts. So they're always pumping you with something, as opposed to the food you've ordered. So you are eating a good, full-on meal. In fact, sometimes it gets too much. But obviously eat as much as you can. Their main thing is basically getting nutrition, making sure your gut's working fine, which it is so far, and getting back to some sort of normalcy. So all being well, if my white blood count continues to rise like this and it goes above 1, or stays stable above 0.5 for about 3-4 days, then they'll look at discharging me and putting me as an outpatient, which is a normal protocol sort of thing. And it can come off 1 a day now, as opposed to 2 injections a day. That's an anti-inflammatory drug. It doesn't affect the graft in any shape, way, or form, so they're happy to keep me on that and wean it down very slowly because they don't want any adverse reactions from the body. So looks good. Looks good. I'll keep you updated on progress next few days. Thank you.